Welcome to everyone. My name is Katie Warren. I am the Deputy Director of the Washington State Association of Head Start and ECAP, and we are really delighted to present this series of Zoom webinars for parents and staff around the Strengthening Families framework with Victoria Hilt. We have worked with Victoria for many years, both when she was a parent ambassador and with KCR, and now when she's very skilled and does training for us at almost every meeting on strengthening families, because she is a specialist and serves on the national board around that, that foundation or trust or whatever it is. I can't remember the name. But I'm really glad that you guys are all here. We have a series of webinars and discussions and things that we are trying to support our community with over the next however many weeks or months that this crisis happens. And I will send everybody out a follow-up email with a link to the calendar. Coming up this week, we have something around, around the census, which is very important for everybody to get counted. We have a Spanish story time. We have chess for preschoolers, which is a fun half hour. We have our regular check-in calls with the entire community every Monday at noon. And then next week we have something that is specifically for parents from Paul Figueroa around self-care. So I will send that out after we finish here. And let's get started.
Okay. So just before we even get started, thank you, Katie. And also, if anybody has kids that pop into the camera screen, that's totally okay. And you may see my child at some point because we are all at home. And she has a life and loves to run around the house. So I'm just giving you a heads up that you may see that, and that I welcome you to have that space, to have that experience as well. And my cat also likes to come visit me while I'm on the computer. So you may also see a cat. To get started, I wanted to just kind of reach out and check in with people about what protective factors are in terms of how we look at families. And so Katie and I agreed that we should do like an introduction to the protective factors to give you all the same base of knowledge. I do work with the Children's Trust Fund Alliance. I am the co-chair of their Alliance National Parent Partnership Council. It's a mouthful. But we do provide insight and advice to the Children's Trust Funds of America through their alliance. Through them, I was able to become a certified trainer. And I'm going to share with you the training, little bits and pieces of the trainings over the next few weeks. So you'll get to see some of the things that I do at the meetings that Katie was talking about. I am going to share my screen so that you can see what we're going to do. So today's goals are slightly shortened from the normal introduction that I would do. And what we're focusing on today is just being able to list 5 protective factors that help keep families strong, which is my main influence or main focus. And they also help prevent child abuse and neglect. The second thing we're going to do is just understand what it means to work with families in a strength-based way. And that also means when you're reflecting on your own family. So making sure that you're looking at your own family with the strengths first, so that you can reflect that out to your community. The last thing that we're going to do is just become acquainted with the Strengthening Families logic model and framework, just so that you have an understanding of what it is, so that in the following weeks, when I bring it up on the screen, you'll know what it is and you'll understand what it is. Now, a few things that I just wanted to elevate before we get started. is that the protective factors are worked into most Head Start and ECAP programs. They're actually part of the curriculum that they use. However, when I was in the program, it wasn't explicitly told to me that they were protective factors. It was something else, like telling me things that were really helpful and kind and encouraging, but I didn't know that they were referencing protective factors. So I may start to explain something and you might go, oh, well, I know what that is, that's obvious. But what I'm trying to help do is put a name to that experience so that later on we can reference it. And so there's going to be a lot that you do know, and I hope that that's the case, and I'm just putting it into a framework so that you kind of get comfortable with it. So first, I want to start off with introducing the protective factors. The Strengthening Families Protective Factors Framework is a national and international initiative, and it's aimed to develop and enhance 5 specific characteristics. Those are the protective factors that help keep families strong and children safe. So the Center for the Study of Social Policy, along with some other funding, developed the framework. And the initial goal was that it would be used in a national systematic way to approach families to help build strong families. And for the most part, it's entirely successful. Everybody who uses it, it does work. Getting everybody on the same page has proven a little bit difficult. And that's why they made this training, so that everybody could get access to the information. Initially, it was created with the intent to be only for those who work with families. When I was trained, I very specifically said, I am seeking to train parents, and people who work with families is fine too, because I believe that it is equally as important for parents to have this information, because we work with families all the time. When we visit them at the park, or when we have play dates, or when we're walking in our neighborhood, any of these things, we're working with families too, because we are in the community. So that is a little bit of background. In order to approach protective factors, and I recognize that I have not named them yet, I will get there. To understand better what protective factors are, we have to look at a strength-based perspective of looking at families. And the best way to do that is with an activity that we're about to do. And when we do this activity, I really want the opportunity to call on people for them to answer, but we don't have a lot of time, so I may only choose a few. I'm going to show you a picture, and I simply just need you to tell me what you notice about this picture. It can be good, it can be bad, it can be a concern of yours, or it can be relatable. Whatever stands out to you, and I want to know the first 5 things that you've seen. So the first 5 things that jump out at you from this picture. And then I'll move on from there. So I'm not sure how to share my screen and ask.
Do you want them to write it into the chat?
That would be great, yes.
All right, so if you go down to the bottom of your screen and hit the chat box, you can type stuff into the chat.
I am trying to figure out how to share my screen and also do the other things. So okay. So please be ready to answer. There are no wrong answers. All right, so this is the picture. And I just would like to know the first 5 things that you notice.
I don't see any chatting.
Oh, here comes chats. Okay, so just a few minutes that we've had here to look at the image and point out what we see. Let's see. So mom is relaxing but smoking in the house.
I'm sorry, Katie?
Yes?
I'm having some difficulty hearing. I used to have the screen, sharing the screen, but now it's not anymore. And I don't know how to do it back again.
So can you go to the share screen again?
So yeah, I put, okay, let's see. ¿Se ve ya? ¿Se ve la pantalla? Okay, yes, thank you.
Okay, thanks. All right, go for it, Victoria.
Okay, so I see a lot of answers and I love all of them. Some of them are highlighting the good and some are highlighting kind of like concerning areas. You know, mom is smoking, but she's relaxing. The house is messy, but it's full of things that they love. The kid seems excited to see dad. There's fishing poles that show that they do activities together. They need cable. Thank you, Joel. Let's see. It shows real life. Absolutely. Can you guys see my chat box? Is that what you're saying?
I think she was telling Maricela that she should close the chat box in order to see the picture.
Okay, I'm like, I don't understand. So the point of this exercise is to stretch your mind and help flip your focus. So like kind of look at the family through a different lens. So some people might walk in and they would see all of the risk factors, like tripping hazards, it's dangerous, there's things that could hurt the child, there's things that could hurt the family, there's things that could be affecting the health of the family. All of these things are true. But when we walk in and we're looking at the family from a strength point of view, we want to focus on the positive. And a lot of you did that. And that's so great because that sets the foundation about learning about the protective factors. And sometimes when we talk about risk factors, we immediately assume that means bad. But what it means is that there's room for improvement. And there's room for growth. And when you grow as a family, you're not just affecting the parents, you're not just affecting the kids, you're affecting the entire dynamic of that family, and that can help strengthen a community, because when you strengthen a family, you're strengthening a bit of the community as well. So that leads me to the second thing that we're going to discuss, which is what the protective factors are, and introducing the pathway to improved outcomes for children and families. So this screen, it sums up what we just did. Focus on what's strong, not what's wrong. And I really encourage you to use this whenever you are thinking about a situation and you're like, what's wrong with this picture? And you say it to yourself, focus on what's strong first, and then focus on maybe what could be improved. And again, we all work with families, and so this can help all of us. This is called the pathway to improved outcomes for children and families. And what the basic idea is that these core functions of the state system and agencies and programs build the parent partnerships, deepen knowledge and understanding, shift practices and policies and systems, and they ensure accountability. And when that happens, then practice and worker practice changes to shift the culture of an organization, make policy changes that help the workers who work with families, and they implement everyday actions that can support families in building protective factors. Worker practice improves because you have the knowledge of protective factors. They change their approach that they take with parents. or the children, and they implement everyday actions. When those things happen, families are supported, and they're supported to build parental resilience, social connections, knowledge of parenting and child development, concrete support in times of need, and social and emotional competence of children. Now, those are the 5 protective factors. Those are the things that we're here to talk about today. So we want to help families build those things. And when you do that, the result is strengthened families, optimal child development, and the reduced likelihood of child abuse and neglect. And from that, you get strong communities. And when strong communities come together, anything can happen. Now, to focus on these protective factors a little bit more, we're going to define them, because you can know what a word means, but in the context, you need a definition. So the definition of parental resilience is the ability to recover from difficult life experiences and often be strengthened or even transformed by those experiences. So often we talk about how somebody bounced back from something really difficult, like a bouncy ball. And I think it's really important that we recognize that we can teach children about resilience through things like a bouncy ball. And we can teach them that, and in turn teach ourselves about parental resilience. So when we say parental resilience, keep in mind your own personal story, which is different for everyone. And it may be difficult to share sometimes, but because of that story, you're now stronger and transformed. So it's something really powerful to think about. My home visitor, when I was part of an early learning program, she definitely pointed out my resilience a lot to me. And I did not understand that this was a protective factor, a building factor for my family with my child. By understanding resilience, I'm able to teach it to my child. So now that I know what it is, I want to share that definition with everyone. Social connections are positive relationships that provide emotional, informational, instrumental, and spiritual support. The key word on this one is positive relationships. When we go over social connections more in depth, there's an actual activity that talks about the difference between positive and negative connections, those positive and negative relationships, the ones that build us up and the ones that bring us down, and how to build up your social connections in a positive way. Knowledge of parenting and child development is something that if you're connected to a Head Start or ECAP program or any other preschool program, you probably have touched on. Actually, if you're a parent, you have touched on this, but understanding child development and parenting strategies that support physical, cognitive, language, social, and emotional development. So that is what that one's all about. Concrete support in times of need, which is what we're going to be starting with next week, I believe, is the access to concrete support and services that address a family's need and help minimize stress caused by challenges. The last one that is on here is family and child interactions that help children develop the ability to communicate clearly, recognize and regulate their emotions, and establish and maintain relationships. And that's social and emotional competence of children. It's a mouthful, but it's really important for this one to be highlighted because this one is really working with families to help their child build up. A lot of the first 4 are things for the families, right? So like the parents, the caregivers, those who are taking care of the child. But the social and emotional competence of children actually focuses on helping the child build up. Now, I personally think that we can build these up in all children, and you can start very young, but that one specifically is targeted towards children. So in the Strengthening Families Protective Factor Framework, all families are included because all families need some support in building needs. It's not just the families that might have problems with the child welfare system. I know that people assume that there are assumptions that any training on child abuse prevention might be done for those who have experienced child abuse or who are going through the legal system. All families need support. And so we want to make sure that those of any situation can access the help that they need. So the other thing that we're going to do each time is build up strategies and everyday actions that can help build the protective factors. And so each one of those everyday actions that are recommended are ways listed here in the second box down, where it says, for example, on concrete support in times of need, which is what we're going to cover next week, the red one. It's asking to create everyday actions to help respond immediately when families are in crisis. So what can you do every day that will help build this up in your community? Provide information and connections to other services in the community. So what can you do that would build that up? And help families to develop skills and tools they need to identify their needs and connect to their supports. So what's interesting about starting with concrete support in times of need, which we'll do next week, is that social connections is a support in times of need. And what WASA is doing right now by having these meetings, these webinars, what many other organizations are having that are being done now are doing is a concrete support during this time of need during COVID. So I just want you to kind of look at this screen and look at the different everyday actions that are suggested for each different item. Give me just one moment, please.
While she takes a pause, I'm going to have you guys do a poll. All right. Can you see the poll? Which of these describes you? Select all that apply, multiple choice, parent, Head Start ECAP staff, director, other. Nope, cannot see. It might just take a couple of seconds for it to show up. Well, you know what? If it doesn't show up, then we won't have a poll.
I can't see the poll either, Katie, and this is Janaea.
I don't think anybody can see it. It's weird because it says attendees are now viewing questions. Oh, maybe it's because we're viewing Victoria Hilt's screen. That's probably why.
That's probably why.
That's right. So next time we do this, we'll do the polls at the beginning. We were just trying to get a sense of where people are from and where people are at, whether they are parents or caregivers or staff or whatever.
We could always type it into the chat box where we are.
Yeah, I think a lot of people are. Yep. A lot of staff.
On this.
A lot of ECAP. Here we have a Head Start. A lot of family services. So for you family services folks out there, how familiar are you guys with the protective factors?
Okay, back. Sorry about that interruption.
Cool.
Okay, so these are the strategies and everyday actions. So as we consider each protective factor in itself, we have to ask ourselves, how does culture impact this protective factor in a family? Because it can make protective factors look different for everyone. We have to ask, How does your own culture shape how you feel, how you react, and what you do or what you think? And how does culture impact what you are teaching? So these are very important things when you're thinking about those everyday actions that you can put into effect that you might consider when you're making up, your goal for that day. And I would encourage you to actually do that. When you are taking your walk, your daily walk, because we have to walk, to get some exercise right now in our time of lockdown. Think about these questions. Think about the culture of your neighborhood. Think about the culture of your community, and think about all the different ways that that might impact how you provide information and connections to other sources. How you might promote engagement in a community in this time of need. What are we doing during COVID? This is a situation that's kind of particular to our specific time in this. I don't think it's unprecedented. That's the word. So I did want to highlight why it's important to build partnerships with families. And the reason it's important is because the families are the center, right, of how we work with children and how we build up strong families. And the partnership with them is kind of key to success with any type of building of protective factors. So the more the parents have access to in terms of information and resources and knowledge, then the stronger that family can be. Highly involved families almost double the positive odds for children in education, health, and social and emotional development. So because it's so important, we got to make sure that we address, why would parents get involved in whatever it is that you're suggesting or your everyday action that you've decided you're going to do. So parents do believe that their family is important, and they do want to do things to build themselves up. And I believe that if we support families and help build their protective factors, then they will feel like they are respected and listened to, and they will continue to provide participation because they'll feel like they're making a difference. So one of the things that the Alliance has done is looked at how do parents stay involved. And if you have multiple opportunities for parents to participate, and if they are given sufficient notice, then their participation will increase tenfold. And when their participation in whatever everyday action you're doing or facilitating, it's just going to have a ripple effect in your community. Now, they did do research, and they found, and I'm sure none of this is surprising to you all, that if participation is expected, then also childcare, transportation, food, being there is supported as well. So parents will participate more if they know that their kids are taken care of, that the kids are gonna eat. A local program here in my area was doing a date night for adults. And you could drop off your kids and you could go on a date and come pick them up. I think it's pretty standard. It happens in a lot of places, but they weren't providing food while that date was happening. So the parents had to either pack something which had to meet these stringent food requirements for being in that facility, or they had to feed the kids before they came, or they had to feed them after. And it wasn't effective. Parents weren't excited about the opportunity. It was more stress than it was helpful. And they changed the model, and they changed it to include food, and you can bring them earlier and a little bit later so that you can go to a movie, because the times before did not match that time. So when they started building the program around the parents and with the parent input, it was more successful, and that lessened the stress of the family and built up their protective factors. Also, those families that were attending were connecting with other people that were using the program, right? So by providing one resource, one thing to build up the parents' resilience, by providing them an opportunity to build their relationship, they also improved the family's social connections, provided a concrete support, and helped the family with the social and emotional competence of their children because they were interacting with other kids their age. Like, it's multifaceted how one simple thing that you do in a community can impact so much of a child's life. So when families are listened to and their ideas are supported and respected, they will continue to participate with you on whatever it is that you're doing. So if I am a parent and I am not necessarily someone who works in a professional role with other families, and I want other families to participate with things with me, I want to keep these things in mind. And it's easy to assume that if one thing works for one person, then it will work for another. For example, me, I am willing to do things, and I take Lisa with me. I take her with me wherever I go. I don't necessarily need childcare all the time because she's pretty capable of managing herself and handling herself. Now, other families may have more kids. I only have one. They may have more needs. And so for them, having childcare provided is essential for their participation. And when we're looking at a community, we have to look at all those different pieces that we kind of touched on before, those questions that you might want to ask yourself. What is the culture of my community? And culture is not necessarily tied to any race or class or any other determining factor. It is the culture of a community. So if the town that you live in is primarily focused on football, that's a key component of its culture. That can be a piece of culture. And then of course your community can be small or it can be large. WASA's network is wide across the state of Washington and even further in other states. And so to say that that community is the same as my local community is not true. So there's different needs for different communities and different neighborhoods and different areas. So we want to make sure that the family participation is recorded somehow. I'm not necessarily meaning like video recording, but that they see that what you're getting out of their participation is having an impact. That is essential to positive parent involvement, where it stays progressively large. So you can get started by involving parents if you are not already, which I have to assume that you are because you're participating in this webinar. But what you can ask parents who are in your program or parents in your neighborhood or anybody that you're reaching out to right now with the COVID pandemic, you can ask them what's hard about parenting right now. And actually right now it would be great if you guys wanted to comment what's hard about parenting right now. I would love to get those responses. And please be real. I was on a webinar earlier with some other trainers, and literally the hardest thing right now for someone was being parent, friend, like playmate, and teacher. How do you be all of those things and still the one that tells them to clean up the room at the end of the day? Yes, keeping kids off screens for several hours a day. Yes. How do we do that? How do we keep them on task? All of these things are so essential and so difficult right now. How can we during this time reach out and support each other? That's another question that I would prompt to you if you're willing to share and be vulnerable about that. Trying to work from home, be a teacher, and do my own grad school work. Yes. I mean, I feel like people can really relate to that. Yes. All of these answers, if you have the access to the chat, please look at them because they are very strong. responses. And I think that we need to kind of elevate what people are going through. You know, sometimes parents go through a lot just in general, and then to add the weight and the depth of this COVID is I am constantly amazed by solutions that I'm seeing from other parents. My kids want me to cook 3 full meals daily. It is not possible. I agree. I absolutely agree. That is, no. They're not infants anymore. They're not toddlers. It's so much harder. We have our teachers sending very short and effective activities for families and children to be engaged. So that's something that's helpful right now, what we can do to not feel isolated. So a comment that I think is really important to highlight is that parents are getting so many resources that it can be overwhelming. We want those resources, yes, but at the same time, we also want to have this space to be, you know, give ourselves a little bit of space to not do those things. I think it's really important. I've been seeing schedules that people make for their kids during this time, and more power to you if you can stick to that, but it's not required. And I think it's a lot harder for some people to put into effect than it is for others. And we definitely want to give people the space to not have to follow that schedule. Working my caseload and also have my kids do their work, having a hard time juggling different grades and ages for schoolwork, getting them to clean up after themselves. One comment, how do we do it all? I don't have an answer for you, but I'm glad that you asked that question. What is hard about parenting is meeting their needs when you can't meet their outdoor needs. So, and then how do you discipline without feeling the crazy from not being able to meet your own mental health needs? Sharing a computer among 4 people. Trying to do it all is the hardest part. Parenting, interning, grad school, teaching them, keeping them on track, as well as attempting to do their therapy activities. Not used to being around my kids 24/7, 7 days a week. Struggling with keeping them on schedule to do schoolwork and dance classes with a baby. All of these answers are really, really good. And they're good to get out there because it gives us the perspective of what's happening in our country, what is happening for our families and what is happening to our communities. So how can we make it easier on one another? You know, how can we make it easier to connect to one another? And asking that question last year would look different than it does now. So how can we make it easier to connect? I know my daughter and I, we go and we get lunch from the schools. And I think a lot of areas are doing that. It's a really great thing. And that may be the only social contact we have that's not on a screen. So how do we limit the screen time while also providing the opportunity to socially connect? It's a very interesting question, and I think it's one that we need to ask ourselves. I also think that it's wild to me that my 8-year-old is doing Zoom conferences with her friends and her school. And that's just what they're doing, and they get it. And she can do things that I'm like, I need to check the volume. Can you hear me? I mean, I don't know if any of you can relate to that, but I can definitely relate to that. All right. So the next thing that I want to share with you, kind of trying to keep track of my time, is just a way to remember the protective factors. And so to do that, you use your thumb to remember social and emotional competence of children, because a thumbs up is one of the first ways we learn to communicate our emotions. Like, you good? Good. Your index finger represents knowledge of parenting and child development, because you are your child's first teacher. Your middle finger can help you remember social connections because it should never stand alone. We all need a positive social network. Your ring finger stands for parental resilience because your first commitment must be to yourself in order to be strong for others. And your pinky finger signifies concrete support in times of need because it is the smallest finger and reminds us that we all need help sometimes, all of us. So when you're thinking about protective factors, remember the hand and the 5 fingers, and they can help you remember what they are and what you might need to work on, or what your community might need to work on when you're out there thinking about everyday actions that you can do to help build your community. So the other thing that I wanted to highlight, actually, sorry, back up. How to remember the 5 protective factors was actually created and inspired by a parent leadership council. And that is one of the ways that it was an example of how the community engaged and built and put input into this piece, and then it was put into this training. And now they have posters that you can get, and there's a website, whatmakesyourfamilystrong.org, and you can download posters, you can share them, you can order some. It's a really great resource. Mostly, I really think it's amazing because it's very parent-led, and I think that's a really positive thing when we're looking at what makes families strong. And so the thing that I wanted to point out to you is that they have done research, and they have found that all it takes is one person to make an impact on a child's life. One person to help them through a tough situation, one person to help prevent that child abuse and neglect, and one person to help if it does occur. All it takes is one person. So if you're thinking that, well, I don't really have that much of an impact, I would challenge you to consider changing your lens and looking at your strengths and how you are already involved in your community. Because I can guarantee you that you are in some fashion. And the other thing that I really want to highlight is the value of actions that are done to a kid and the value to an adult. So when we are working with families and we're working with children, things that we do to other adults may not seem as impactful as it does for that child. Teaching a child how to regulate their emotions or put a name to an emotion has more of an impact than, say, if I went up to an adult and I said, it seems like you're really upset right now. Do you need help identifying why? Like, it's not going to be the same thing. And so when we're working with families and when we're working with children, we have to remember that the lens that we're using, the glasses we're using to see that family, have to reflect like all pieces of that family. And so I just wanted to highlight that. And this last screen that I have up here is about next week, concrete support in times of need. Make sure you're asking for help if you need it. Even in this time of social distancing, we still have the ability to reach out and say, I need help. And there are people in the communities that are helping, or maybe you are the person in the community that is helping, but there is help. So please ask, and we'll highlight that more next week. So I would like to open it up for questions or comments or clarifications. Again, this is just one tiny snippet of the information that I have. And so I just wanted to get that to you guys.
And you can type in the text, or you can unmute yourself is another option. If you go down to the bottom left corner of your screen, you can unmute yourself, or if you've muted yourself on your phone, or some combination thereof. And I also wanted to mention that, so when I send the follow-up email for you guys. I'm going to include a link to a survey that we're doing with parents to get a better sense during COVID-19 of what additional supports that parents need. So for the parents on this call, I hope that you will answer that survey and share it with other fellow parents, and for the family support people and directors, I hope that you'll share it with your families. We're really looking at what grants we can apply for to provide additional supports for families, whether it's financial or legal or whatever that might be. So yeah, we would be very interested in you doing that.
And I would definitely encourage any parent, if you have thoughts on this, or really anybody, but definitely speak out about what's happening during COVID, or what's happening when all of this, when like the lockdown piece of it is over, what other things are going to happen. So on another call I was on, people were talking about, okay, well, my power bill, my power won't be turned off now. My power bill is the due date is being pushed back because they know this is happening. But when it's all over, how am I going to get out of that hole? Like the hole is going to be so much more, it's going to be deeper than it is now. So what do I do then? So I think, Katie, I think it's great that you guys are doing that survey, because really, truly, we are the experts of our own lives. And so we know what's going to happen next to us in terms of what stressors we're going to have, or what barriers, what help we might need. And it can't be helped or changed unless you're at the table.
Victoria?
I really like the saying. Yeah.
I have 2 questions here in the Spanish license. One is from Steph.
Okay.
She said that if she can have access to the PowerPoint that is in Spanish.
Yes.
Okay. Sí, sí puede tener acceso. And the other one is, what can I do if my children are very active and I don't have enough skills to help them, or when I take him, so hold on. Reina, cuando usted hace esa pregunta, ¿qué puede hacer con los niños hiperactivos? O sea, ¿se refiere a un niño de qué edad? So when we are not ready with childcare and my child is very, very active, sí, puedes continuar hablando. Yo te voy a interpretar ya de manera simultánea. So when my child is pretty active and it's I don't have access to childcare. But then they in the childcare, what they said is that we are not prepared enough to receive these kind of children. So what is the suggestions for these parents?
Okay, so I just want to make sure I understand correctly. There is childcare that is available in the area. However, they're saying we don't have the ability to support the needs of your child right now?
Yeah, that is correct.
First, that's a very disheartening thing to hear during this time. But I think we can all kind of understand if they're limited in staff or limited in number of children that they can have. I know one child care center was struggling because they could only have so many people in the building in order to follow the sanitary and disinfecting rules. I don't know what to do in that situation. Katie, you might have more insight onto that, but it sounds like something that a lot of people are going through right now. Maybe not necessarily if they're very active, so we can't support the need, but in general, you know, we don't have the ability to support that right now. Katie?
Yeah, I have no idea what to tell you. Yeah, I don't know, Marisela and Reina. Lo siento. All right, well, thank you, everybody. I've included a couple of links in the chat. One is for our weekly COVID-19 updates and discussion call on Mondays, and the other is the link to all of the different things that we are doing, which gets updated on an hourly basis. And we will include that in the follow-up email as well. Thank you all so much.
Oh, I was just going to say they can all have access to the PowerPoint. I'll send it to you.
Okay, great. Awesome. Thanks. We had a couple of requests for that, so I will definitely include that. All right. Thanks, guys.
Thank you.
Bye.